Do you have DID? Do you need to go to the dentist? Well, boy, do we have a qualitative research paper for you. Quick and light trigger warnings for this video include surgery, self-injury, and sedation. Hello, we're the Ring System, and today we're going to talk to you about a qualitative paper that really digs in depth in how a specific DID system navigated receiving oral surgery and how their dentists accommodated them throughout the process. This is a unique look into a specific situation, but it's also part of a larger conversation about what accommodation for people with DID looks like in medical healthcare settings and what it means to consent to a medical procedure when you have DID. This paper is a case study, which means that it looks at the specific experiences of one individual, analyzes those experiences, and looks at what we can learn from them. So let's get into the specific situations that this paper revolves around. Someone with DID, an anonymized patient, came into the dentist's office and they needed to have their wisdom teeth removed. They were open with their dentist about their diagnosis of DID, and from there, they engaged in a collaborative process between the patient and the dental care team on how best to accommodate them in surgery. And to give you a spoiler, there was no problems in the entire procedure and it went completely smoothly. As I mentioned, the patient was open about their diagnosis. They came into their initial consultation talking about how DID affected them, and they also made the dental team aware of the individual members of their system. They didn't have any particular problems that might interfere with the surgery. In fact, the biggest issue had nothing to do with the surgery itself. The issue was that they needed someone to bring them to and from the surgery, and the only person available was their father. One of their younger system members did not have a good relationship with their father. So in the intake appointment, this system made sure to plan ahead with the dentists that if the younger system member was fronting the day of the surgery, that they could call the dentist's office and postpone the procedure to a later date. Secondly, they struggled with anxiety around medical procedures in general. They talked about this with the dentist in advance and were presented a couple options, but eventually they agreed that the best option would be to receive some conscious sedation where they remained awake, but it would help lower their general levels of anxiety during the procedure itself. Next, the dental team stepped in and had a suggestion. They knew that coming off of conscious sedation could cause some anxiety and potentially even panic in patients. They made a plan to make sure that there would be a dental assistant in the room with the DID system after surgery, as they were coming off of the sedatives, to provide reassurance and support in hopes of preventing anxiety and potential panic. And again, everything went smoothly for this system. And beyond simply having a smooth and easy procedure, their dentists went on to publish this study. Obviously, this is not a burden that we have to carry as people with DID, but when we can and when we choose to, it really shows the power of how being open about our diagnosis, particularly when we're met with healthcare providers that have an open mind, the changes that we can make in the academic and professional community. And this sentiment about education is mirrored by the authors as well. One of their big points is that the education of healthcare professionals in all areas other than mental health is crucial when it comes to supporting patients with DID and making sure that they're properly accommodated in appointments and surgical procedures and everything else. And so they published this paper with a bunch of recommendations for other healthcare professionals. I'm going to go through those as well in this next section about what the dentists recommend that other healthcare professionals do. Their first and probably most basic recommendation is to simply approach each DID patient uniquely. This is advice that I think is applicable in all sorts of circumstances, whether it's about DID or another mental health condition. Thinking about basic things that could come in the way of consent. How severe are your symptoms? Do you have a basic level of functioning on a day-to-day basis? Do you have an ability to understand the healthcare you're receiving? And can you communicate what you would and wouldn't prefer when receiving that healthcare? And the dentists really hinged on that last point in the rest of their recommendations, this idea of what people would or wouldn't prefer in their procedures. They talked about how it was really important to attune to that in the specific patient you're seeing. This could be easily established during the intake process as well. Their first recommendation on these lines is to really get to know how DID is impacting that specific patient. So basic things like getting to know each individual member of the system, their names, their ages, what would make them feel comfortable when receiving healthcare, and making sure to have that conversation before any serious medical procedure happens. The dentist specifically noted that in this conversation, it was important to get an understanding of what might trigger a switch in the system. For example, if one system member consented to the procedure and felt more comfortable receiving the medical procedure and another system member didn't, it was important to be aware of what might cause that second system member to involuntarily come to the front, and to make sure that whenever possible, to avoid anything that might cause that switch. Knowing all of this information makes sure that the dentists and the healthcare team can have clear and accurate information with the patient throughout all parts of the procedure. The dentist specifically noted that it was important to inform the entire healthcare team, anyone who might possibly interact with the patient, about the information that they had DID, who might be around for the procedure, and what might trigger a switch and how to avoid it. The dentist talked about the potential of collaborating with the patient's therapist or social worker to gather and process this information, but noted that it was absolutely essential to prioritize the privacy and the autonomy of the patient above all else when considering contacting the therapist. The dentists also had some general advice that was applicable to all systems that might present to healthcare. Their primary recommendation along these lines was to reduce general levels of stress and anxiety during all phases of the process. So this was prior to the surgery in intakes and consultations, it was during the surgery, and it was after the surgery. This was an ongoing process. The authors talked about how it was very important to be aware that serious medical procedures could be traumatizing or re-traumatizing to patients, and that it was important to take any and all steps that could be taken to prevent this traumatization or re-traumatization. Their second recommendation for all systems was simply asking who is fronting at the time of the appointment. And beyond asking who is around, to ask them if they had any specific needs or preferences that would make them feel more comfortable when receiving healthcare. And then their third general recommendation was to generally be aware of the role of trauma in DID and the potential for patients to have self-injury behaviors related to that trauma. This is important for the intake when discussing the different members of the system, to see if there's a system member that might hold those self-injurious behaviors, to be aware that them getting triggered and switching into the surgery was a possibility, and also to prevent that involuntary switch when possible. Overall, I think this paper was surprisingly well informed when it came to accommodating people with DID in dental and healthcare settings. It covered a lot of ground, and yet it still felt very centered in the unique needs of the patient and making sure that they felt comfortable throughout the entire process. Anyways, to go on a slight tangent and also to situate this paper within a broader academic conversation, I want to talk about consent and DID. This paper in particular didn't have a lot to say about consent. Thankfully, the procedure went smoothly and according to plan, and in this case, that meant the same exact system member was present for the consultation, the surgery, and the follow-up. There was no switching involved. So therefore, the paper didn't really have too many insights on what it means to obtain consent across system members. However, this is an area of the academic field that does need more work. There is relatively little academic literature about what it means to obtain consent if a switch happens, and unfortunately, the literature that does exist is in a bit of a controversy around this. There are authors like Margot Rivera that argue that people with DID can make reasoned decisions and live well with the choices they make. But there are other authors that argue that simply due to the fact that there's more than one agent and consciousness within a body, it is difficult, if not impossible, to obtain informed consent. This is due to things like switching, questioning whether every single system member needs to give verbal consent, and whether or not there are undiscovered system members who might not be able to give that verbal consent. However, in our opinion, arguments that people with DID can't consent often lack an understanding of how system members can communicate with one another, both internally and externally, to reach a consensus and a shared decision. And again, this is an area where more research is needed. Discussions about communication between system members are often relegated to a chapter or less in large books about the treatment of DID in clinical settings specifically, and academic literature rarely takes those ideas and applies them to other settings. However, there is one good master's thesis we have found on this subject. Timothy Brennan wrote a thesis specifically looking to determine the medical decision-making capacity of patients with DID from a patient-centered approach. And despite our misgivings about how this paper frames DID as a whole, we think it does a very good job on this particular issue. Upon analyzing how internal communication and cooperation works, Brennan concluded that the patient's autonomy and self-governance should be prioritized whenever possible, and that only severe value incongruence and conflict between system members would indicate the inability to reach a decision. Basically, more often than not, people with DID have the capacity to consent. It's only when there is severe infighting within the system that their ability to consent should be questioned. We're not that many videos deep into the series, and I already feel like there's a trend developing where at the end I say there's more work that's needed in this particular area. But it's true. This subject in particular directly and critically impacts how people with DID function in medical settings. I think the roles of internal communication and cooperation in decision making can and should be explored in much greater detail. And I have hope that the field will continue in this direction in producing more content in this specific area from a patient-centered lens. And this study about DID in the dental care setting is a good step in that direction. And at the very least, it gives very good information about how to accommodate systems in medical settings. To close, I want to mention that, as always, we put the link to the specific paper in the description. So if you, the viewer, have DID and are going to receive dental care and want to be open with your dentist about your DID in hopes of being accommodated in their office, feel free to grab this link and send it directly to your dentist. This study is a great educational resource for them, and hopefully it can help you navigate these situations with a little bit more ease. Thank you so much for sticking around and watching this video, and as always, take care, good luck, and we will see you in the next video.